The Health Ministry is scrambling to avert a health crisis. The nation's nurses are unhappy over unpaid allowances and they are seeking to paralyze the service by refusing to go to work. The ministry is feeling the heat.
The executive committee rallied nurses and threatened a strike sometime in June 2021. Government contacted them and discussions were held, headed by the Secretary General and head of the civil service. Allowance suggestions were made and an agreement was made to pay the allowances at the end of August 2021. Work had since begun between the Secretary General's office, Ministry of Health, Personnel Management Office, and Ministry of Finance to be able to pay at the end of August 2021. The finalized document had to go back to Cabinet for final approval, which happened on the 26th August 2021. These very important steps take time, and that made it difficult to put it on the payroll for August 2021, because the inputting into the payroll is closed by the 5th of any particular month. This was communicated to the Executive Committee of the Nurses and Midwives Association, who were reassured that payment will now be made at the end of September, and it will be backdated to August 2021. Unfortunately, before this communication, there were already threats of a strike by some nurses, and even after hearing this information, the threats of strike continued. Distinguished ladies and gentlemen, this government is very committed to the welfare of all Gambians, especially by providing good quality health services for our people. In the same vein, government is very committed to the provision of a well-trained, well-motivated, and high-performing health workforce. This is the reason why government is always going out of its way to provide the needs of the healthcare providers. I wish to remind all the nurses and other healthcare workers that we all chose this field of work for one reason, and that is to provide services to the sick and needy. I'm sure we all remember one of the favorite questions of the interview panel before we gained admissions into various health institutions is, why do you want to be a nurse, a doctor, a public health officer, laboratory scientist, pharmacist, physiotherapist, and so on? The answer most of us gave was to save lives. How come we are talking about striking when we know that that could lead to the loss of valuable, irreplaceable lives and suffering of our people?
Health Minister Dr. Ahmad Lamin Samate, at his interviews with reporters on Tuesday, made the bold charge some politicians are influencing these nurses.
These have made it very clear what a civil servant can do and what he cannot do. Under these rules, strike is illegal. What an aggrieved person can do is to resign with 1 month notice or immediately by paying 1 month's salary to government in lieu of notice. We have also condemned the misguided utterances by some of the executive members of the Nursing and Midwives Association, especially the public relations officer. We have come across communication from him on the social media where he put disrespectful statements on His Excellency the President, myself as Health Minister, and my team. We condemn his behavior and warn him that that behavior will not be tolerated. He even went ahead to tag an opposition element, which goes to point his motives. We have also realized that he is also fond of giving misinformation with regards to the Gambia's health sector as being the worst in Africa. This statement is certainly not true, and we wish to inform him that he does not have the competence to make such statements, as he lacks the experience and exposure to make those statements.
Dr. Samate insisted nurses took up nursing to save lives. On Wednesday, however, The nurses held a press conference to respond to the minister's claims. The nurses are standing their ground and said they will only report to work after their demands are met. TFN News Review, Mati Senghor.